Hello, and welcome to the University of Texas at Arlington Graduate Nursing Preceptor Orientation. On behalf of all UTA graduate nursing faculty, we are so appreciative of your commitment and service to our students. In this orientation, our goal is to outline some key information to help promote effective clinical education in the practice setting. This graduate nursing preceptor orientation will provide information on our graduate nursing programs and course objectives, including the criteria for graduate nursing preceptors. We want you to leave this orientation with an understanding of what to expect during your time as a preceptor for our students. Expectations of the student, preceptor, and faculty will be outlined. Additionally, you will be provided with information about who to contact should issues arise during your clinical preceptorship with our graduate nursing students. Finally, we hope to provide helpful suggestions to support you in being an effective preceptor. The University of Texas at Arlington is a comprehensive research, teaching, and public service institution whose mission is the advancement of knowledge and the pursuit of excellence. The College of Nursing and Health Innovation vision is to provide innovative, exceptional education through research and practice to advance health and the human condition globally. The ConHI mission is to advance global health and the human condition through transdisciplinary collaboration by engaging in high-quality teaching, research, scholarship, practice, and service to prepare a diverse population of health professionals and to reduce health disparities. Thank you, preceptors, for sharing our vision and partnering with us in efforts aligned with our university and college mission. The UTA College of Nursing and Health Innovation offers several graduate nursing programs with clinical experiences. Our program and certificate offerings include 7 distinct nurse practitioner specialty tracks and a nursing education program. Clinical practice requirements are aligned to the nurse practitioner population focus and are used by the clinical coordination team to ensure that the practice settings and preceptors are appropriate to each student's population focus prior to clearing a student for clinical. The Graduate Nursing Clinical Preceptor Resources webpage, where this preceptor orientation video is located, provides specific clinical course objectives for each program. You may click on each of the program specialty track links to view the associated clinical practice course requirements, course description, and student learning outcomes. The course syllabus includes the course objectives, and students are expected to provide the preceptor with a copy of the course syllabus at the start of the clinical experience. This allows the preceptor and student to work together in creating an optimal learning environment where the student is able to learn and practice in a supervised clinical experience, while the preceptor is able to effectively assess the student's progress in successfully meeting the clinical course objectives. This information is also available on the Preceptor Resources webpage, where preceptors can download a copy of the program outcomes associated with each program track and course number for easy reference. National accreditation standards have been used as a framework for determining the criteria for serving as a UTA graduate nursing preceptor. All preceptors are required to hold an active, unencumbered provider license in the state in which the precepting experience will occur. Preceptors are required to have a minimum of 1 year experience in the clinical practice setting role of the clinical program specialty. Preceptors must have a graduate level education, and the clinical experience setting must align with the respective graduate nursing MSN education program or MSN nurse practitioner specialty track clinical requirements. To precept for the MSN education program, a preceptor must have a minimum of 1 year experience in nursing education with 2 years of experience in nursing. The primary responsibility of the preceptor must be in nursing education, and the preceptor must teach nurses or nursing students directly in the clinical, hospital, or didactic academic setting. The preceptor packet includes information on the preceptor roles and responsibilities that the student is responsible for discussing with the preceptor prior to arranging a clinical rotation. After reviewing these responsibilities, if you agree to precept a student, we ask that you please complete the preceptor agreement and return the agreement to the student along with your current CV. Established preceptors are not required to submit a copy of the CV if this has already been provided to UTA within the last year as part of a completed graduate student clinical experience. The clinical coordination team will contact established preceptors annually via email to validate the currency of the preceptor CV in our records. If the preceptor CV is current, we will ask you to attest to the currency of the information. If your CV is not current, we will provide you the opportunity to resubmit a current version to maintain your preceptor profile in our clinical management system. Please note the preceptor agreement and a current preceptor CV must be on file at UTA before the student begins the clinical experience. The preceptor is expected to bridge the gap between theory and actual practice for the student, serving as a role model and mentoring the student in professional development. The preceptor is expected to orient the student to the practice setting, organizational policies, and key personnel. The preceptor supervises the student in the clinical setting, provides constructive feedback to the student about their performance, and collaborates with faculty on remediation efforts when needed. The preceptor maintains open lines of communication with the student and the faculty, providing feedback as needed, and notifies the faculty promptly of any concerns regarding the student's performance. The preceptor will provide opportunities for the nurse practitioner student to evaluate, diagnose, and develop treatment plans, followed by a discussion with the preceptor. As a preceptor, you are also expected to evaluate the student by completing a preceptor evaluation and review the evaluation with the student, offering constructive criticism and encouragement along the way. Students are expected to provide proof of nursing license and immunization status as necessary, and submit the signed preceptor agreement to the clinical placement management system and other required clinical clearance documents before beginning the clinical experience. The student is expected to review all existing UTA protocols with the preceptor, as well as follow any site-specific clearance requirements and protocols. Students are expected to arrive at the site on time and dressed professionally with a UTA student name tag, and are required to document all clinical encounters within 7 days of the experience. When supervising clinical students, the preceptor is expected to collaborate with the clinical faculty and provide input on student performance by completing the final evaluation of the student. At the start of a clinical experience, you will receive an email from the clinical faculty with their contact information. Save this contact information for corresponding with the faculty. Near the conclusion of the clinical experience, if you are a preceptor of a nurse practitioner student, you will receive an email with a link to complete the evaluation of student performance. The evaluation is fully electronic and requires you to evaluate the student performance in a variety of categories on a Likert scale, if you are a nurse practitioner preceptor. Be sure to evaluate the student in a timely manner and review the evaluation with the student, offering constructive criticism and encouragement. MSN Education has a slightly different process for evaluations. The preceptor evaluation will be provided to the preceptor in hard copy, and the evaluation will be completed together with the student in the clinical practice setting. The faculty member will then ensure the records are filed at UTA electronically. During the practicum, the clinical faculty are available via email, telephone, or virtual meeting technology to provide support to the student and the preceptor. Preceptors will receive correspondence from the faculty at the start of the clinical or practicum experience. The faculty will communicate with the preceptor regarding the student's progress throughout the clinical experience. The faculty is available to discuss the program requirements and objectives with the preceptor. Collaboration is really important. The faculty will communicate with the preceptor regarding the student's progress and will evaluate and grade the student's clinical performance. The clinical faculty is part of this mentoring experience with the preceptor. If at any time during the clinical experience there is an issue with a student, preceptors can readily contact the program director or the clinical course faculty. Program director contact information is located on the Preceptor Resources webpage. Please contact the course faculty if you have any of the following issues or concerns during a rotation. If student performance is not as expected, to discuss remediation. If you have questions regarding course expectations, if you have questions about preceptor expectations, or if you have any other concerns regarding student compliance with policies or professionalism. The course clinical faculty is the first point of contact for all clinical-related communication. The course faculty contact information is provided and available to you on the welcome email you will receive at the start of your clinical experience. If the clinical faculty cannot be reached or for any other correspondence, you may email the program director or graduate nursing administration team at grnurseadmin@uta.edu. Preceptors have the right to send a student home from clinical if the student is not prepared for clinical or if the student is not behaving in a professional manner. Concerns about any student should be discussed with the faculty and documented in an email to the faculty. Concerns about any student clinical performance should also be documented on the preceptor evaluation of the student. The faculty is responsible for determining the final clinical grade for the student. There are benefits to precepting at the University of Texas at Arlington. Graduate nursing preceptors are provided an honorary title of Graduate Nursing Clinical Education Specialist that can be used on your CV. Access to our electronic resources is provided for the academic year in which you precept, including access to the university library and an opportunity to participate in free continuing education courses. Links to access these materials are provided on the Preceptor Resources webpage. Preceptorship is a working relationship between an experienced practitioner and a beginner. The preceptor helps to bridge the gap between reality and theory. To be an effective preceptor, it is helpful to review the student's goals and objectives, orient the student to your site, provide a one-on-one experience to fulfill student goals and objectives, and be a role model, sharing values, philosophies, and clinical pearls. You can also give students ideas on how to facilitate clinical reasoning and skills when appropriate, and offer frequent feedback as the students progress. At the end of each clinical day or weekly would be ideal. This is expected to be an active clinical experience, not observation only. For nurse practitioner students, it's important to let the students see patients. As a preceptor, you might consider assigning a patient to see for history and physical examination. While the student is seeing their one or two patients, you can see other patients. Then, when the student is finished, in between your patients, you can have the student present their patient, tell you the diagnosis and treatment plan, etc., prior to completing the patient visit. There's a 5-step micro-skills model of clinical teaching that is known as the 1-minute preceptor. You can see the citation for this model below, and the method is used where a student first sees a patient prior to requesting input and guidance from a preceptor. The model can be used in all types of clinical instruction for improving the efficiency and effectiveness of student-preceptor interactions. The microskills are, first, to get a commitment by asking the student what they think is the right answer in a particular situation or patient case diagnosis. Second, probe for supporting evidence by gently asking questions to know why the student has chosen their answer. Third, teach general rules such as pharmacology drug class actions or material that is pertinent to the current situation, but also applicable to a variety of potential clinical encounters. Fourth, reinforce what was done right. And fifth, correct mistakes. Students are at different levels in their educational progress and clinical experience. It's important to understand that some students will be more advanced than others. Students in a clinical practice 1 course are just starting their clinical experience and will be very new to the clinical setting, hesitant to make a decision, uncertain of themselves and their abilities. They should grow and have more knowledge in subsequent clinical courses. In their final practicum course, they should be more advanced. The MSN Nurse Education program has 1 practicum course only, and this slide pertains more to the nurse practitioner curricula. Some additional suggestions are first to be patient. Remember that student progress is a continuum and a growth process. Facilitating their learning will help to grow their confidence, knowledge base, and skills. Discuss the student's strengths and areas for improvement. Another suggestion is to debrief with the student at the end of each clinical day and provide positive feedback. Provide areas of improvement with specific skills. Another suggestion is to provide reading assignments and/or research assignments to students to complete in between clinical days to help solidify their knowledge. Follow up with the student after they have read or researched your assignment to discuss what they found and assess their retention and understanding. On behalf of the College of Nursing and Health Innovation, we sincerely appreciate your willingness to share your expertise with our students and to serve as a preceptor.